Our journey began when a physician, Dr. Albert Schweitzer, left his home country, Germany, in 1913 with a life mission of providing essential medical services to underserved Africans in Gabon. Today, we carry out his legacy as Albert Schweitzer Fellows by improving the health of vulnerable immigrants in Baltimore.
The International Refugee Committee reports that approximately 6,000 refugees from over 70 countries have resettled in Baltimore City and surrounding counties. These immigrants moved to the United States for a better life.
Immigrants use less than half of total healthcare costs as compared to their American counterparts. However, they account for 3 times more in emergency department costs.
We are 3 pharmacy students from the University of Maryland working on a year-long fellowship project to address clinical health issues among the immigrant population in Baltimore.
We focus on the prevention of chronic disease states such as diabetes and hypertension by providing free health education sessions.
Free health screenings at their places of business and worship, and resources to navigate the American health insurance system.
So over the past year, I've worked with the Albert Schweitzer Fellows and have been very impressed with how these students have really gotten into the community and really have addressed the cultural sensitivity and needs of this population. And these are students that are very unique in that not only were they involved in the Albert Schweitzer Fellows program, but they're also members of the Student National Pharmacists Association. And through the joint membership of both, they really are looking to build the transition for something that they've started in the community.
Our goal is to find a permanent home for this fellowship project. Turning this project into the hands of our SNPhA chapter will ensure its longevity because our project ends in April 2015. Also, members of SNPhA will be able to improve their clinical skills as well as become more culturally competent.
To achieve our goal, we require more collaborative efforts and expansion to more immigrants. Some of the contributing factors we wish to address are high medical costs as a result of inadequate education on healthy lifestyles, reduced access to health insurance plans, language barriers, and finally, insufficient educational and medical supplies. Receiving funds from this competition will enable us to purchase more blood pressure cuffs, more blood glucose testing strips and educational materials, transportation for immigrants and students, and hiring of interpreters during our workshops.
As much as pharmacy can be involved in connecting people to the right resources or doing even medication education for people who are already on medicines. This is especially true of people from other countries where chronic disease is less of an issue because people are diagnosed with many acute illnesses. And so the concept of having to take a medicine every day is actually brand new to a lot of people.
So यसरी टक्क दिनमा कतिवटा खाने भनेर बिहानको लागि पनि छ बेलुकाको लागि पनि छ अनि राख्ने अनि कट्टामा छैन भने मैले खाए बस्छु किनभने धेरैवटा औषधि भयो भने बिर्सिन्छ खानालाई अब
So in this kind of Coke, there's 39 grams of sugar.
39 ग्राम चिनी छ यसमा.
How many of us like sweet drinks?
कसले उयो मन पर्छ? मन पर्दैन कसैलाई?
Our main site is the Collaborate Care Pharmacy and Wellness Center, a pharmacy owned by Dr. Ayuk. This is where SNPhA members will hold bi-weekly workshops for immigrants.
So the goal would be management, lifestyle, educations. So at the end of the day, they're saving money, they're living better, they're living happier lives.
Following these steps, the outcomes we hope to achieve are
increase refugees and immigrants' baseline knowledge on chronic disease states.
Enroll eligible members into Affordable Care Act plans.
Provide monthly preventative screening services at workplaces, worship centers, and the collaborative care independent pharmacy.
Reduce the number of preventable emergency department visits and hospitalizations. Allow them to save money and live better.